what brought you to start doing Feldenkrais?
Oh, goodness. Okay. You want the long version or the short version?
Pick one.
I'll try to go. I'll give you middle if I can. So my journey, I guess, in a shorter frame, starts back about 4 years. I, through a convolution of situations, and we're not really sure what led to what, but ended up with a chronic pain issue in my sternum and rib cage. So I basically was dealing with pretty much an inflammation of all of the muscles and the cartilage in that area. And we'd make a little headway, and then everything would get worse. And the longer we tried to treat it, and not successfully, kind of the worse things got. And what we have come to discover, so my dad's a doc, and that helps because he can go back and do all sorts of little studies and things, but he's also trained in clinical hypnosis. So I've always been very open to alternative therapies. I've had acupuncture for many years for knee stuff and back stuff, and we had tried all of that. Didn't know anything about Feldenkrais, but had tried pretty much everything. Reiki, you name it, I'd done it, it hadn't helped.
Okay.
It would help a little bit, but it hadn't solved the problem. And one of the things my dad was starting to discover was that the longer you go in pain, the more your brain chemistry actually changes. And so your body stops being able to sort of perceive things the way it used to perceive things. And all that shifts, which obviously then makes it even harder to get better. And my dad went to the national conference of the, I think it's National Society of Clinical Hypnosis, one of them. Met this guy who's an anesthesiologist by training and has worked for a number of years with patients dealing with the type of pain I had, which was basically a larger region of complex pain that no one really is totally sure why you have or why it's not going away, but no one really thinks it's permanent either. Fun. So he had had a lot of success with patients doing a combination of Feldenkrais and hypnosis, with the premise being that you almost have to reset the brain and the body in order for it to be able to heal itself, because it's a combination of it can't heal itself, but also once it starts to heal, the brain can't recognize that it is healing or that the pain source is gone, and so then it keeps sending the signals. And so I would be in pain, which would cause the muscles to contract, but the muscles contracting would cause the pain. But started coming to see her about 1.5 years ago. So I had been, at that point, in pain for 3.5 years almost.
Wow.
3 years. Probably about 3 years. Had surgery. I had my xiphoid process removed. That helped, but didn't solve it. So started working with her regularly and also doing hypnosis. And eventually was able to come off the painkillers. And after being on, and I was on, you name it, I had been on it at some point. Been off of all of that since this summer, and have been, I'm back to full, like, it's as if it never happened, basically, at this point, with the exception of, I have all this awesome experience that I've gained, but,